10 things I would never do as a cosmetic dentist. Hey everyone, I'm Dr. Simmi, a cosmetic dentist based in London. I've been a dentist for 10 years and I'm here to tell you how to protect your teeth and the 10 things I would never do to my teeth, knowing everything that I know. Let's get into the video. Number 1, I would never brush my teeth after breakfast. Every time we eat, our mouth goes into an acidic state as the pH level drops. And when this happens, if you brush your teeth directly after that, you are basically pushing that acid into your tooth enamel and it's going to cause acid erosion, which is why you should always brush your teeth before breakfast, not after. And if you want to do something after you've eaten breakfast, then you can rinse your mouth with water or mouthwash, or wait at least 30 minutes before you brush your teeth again. 2, I would never use charcoal toothpaste to whiten my teeth. So charcoal toothpaste is extremely abrasive, and really charcoal toothpaste or any toothpaste where you can physically feel the little abrasive particles in the toothpaste are going to be too abrasive and damaging for our enamel. It actually causes small micro scratches and tears in the surface of the enamel, which can then cause your teeth to pick up more staining, looking even more yellow, and then would basically defeat the purpose of you using charcoal toothpaste for teeth whitening. So definitely don't use charcoal toothpaste. If you want to whiten your teeth, come into the clinic to see your dentist to do professional teeth whitening. 3, I would never straighten my own teeth using DIY aligners that arrive in the post. Honestly, this whole thing is kind of absurd to me, but it has become a trend and there are some brands out there, unfortunately, where they post potential patients impression materials to take molds of their own teeth to send to somewhere, I don't know where, that makes aligners for them and then post them back to the patient. Now, the danger with that is that there is no checkup or x-ray or any kind of health assessment done beforehand. Most of the work I do in my clinic in London is orthodontic treatment, so Invisalign and metal braces. And let me tell you, before I put any patient into aligners or fixed braces, I do a very comprehensive examination, OPG radiograph, which captures all of the teeth in the mouth, the bone level, we look at the gum condition, everything, and we assess all of that as well as photographs, scans, etc. before we put patients into braces. So the fact that you're able to just use putty at home to take an impression of yourself, which can't be very accurate, to create your own aligners is really dangerous. If you want to straighten your teeth, please go into a clinic and see a dentist or an orthodontist. If I myself needed a medical procedure, I would never try to DIY my own medical procedure at home. I would go in and see a doctor. And so in the same way, if you need dental treatment, don't try and DIY your dental treatment at home. Please go in and see a dentist. It's really that simple. Don't take risks with your health. I think there's a lot of things that we can buy on Amazon or online, and hey, I love online shopping as much as the next person, but I think when it comes to your health and your teeth, something medical or dental, don't take the risks. Go in and see a dentist or a doctor. 4, I would never forget to use a tongue scraper. Our tongues honestly harbor so much bacteria and debris and food in the mouth, and oftentimes people focus on brushing their teeth but kind of forget about their tongue. So you need to be using a tongue scraper twice a day after brushing to remove that coating of bacteria and food and plaque off of your tongue. It is honestly the quickest way to fresh breath. So use a tongue scraper. 5, I would never order whitening gel off of the internet. There have been a lot of cases where whitening gel has been ordered online and then tested to see what the concentration of the gel is, and the concentration was not as advertised, which can be very dangerous because if it is too high and it is above the legal limit, there is a chance that you can actually damage your enamel. So the best thing to do if you want to whiten your teeth is come in and see me for a consultation if you're based in London, or your local dentist, and get a professional assessment on your whitening and get a professional whitening kit made. A professional teeth whitening kit is safe, effective, and it will get you the results that you want. 6, I would never drink lemon water without a straw. Now I know drinking fresh lemon in water has so many health benefits, which I don't want to take away from. Whilst lemon water is really alkalizing for the body, it is highly acidic in the mouth, and therefore it can cause acid erosion of our tooth enamel, which can weaken it and cause our teeth to become more yellow. So make sure if you're going to drink lemon water, you are using a straw, and I would rinse with water afterwards as well. 7. I would never smoke cigarettes or vape. I know people don't want to hear this, but smoking and vaping has so many negative effects on our oral health. People that smoke are at a much higher risk of developing mouth cancer, and it increases your chance of getting gum disease. So please try and quit smoking if you can. It really does have negative effects on your oral health as well as your overall health. So yes, try to cut down, minimize, and if you can, stop completely. I honestly have never smoked a day in my life, and it's because I'm a dentist. I just know too much, I know too much about our health. I can't smoke. 8. I would never use mouthwash straight after brushing. Mouthwash is meant to be used at a separate time to brushing your teeth with our toothbrush. So after lunch is amazing to get rid of the acids in the mouth. It contains a lower dosage of fluoride to toothpaste, and it will coat your teeth with fluoride, which helps to remineralize the enamel. But if you brush your teeth and use mouthwash straight after, then you're rinsing that higher concentration of fluoride from the toothpaste off of your teeth and replacing it with a lower concentration of fluoride that's in the mouthwash. So it's kind of counterproductive, and it's not how mouthwash was really designed. So it's a huge mistake that a lot of people make that people don't realize, but use mouthwash at a separate time to toothbrushing. 9. I would never have a mouthful of crowns placed abroad. I know it's become quite trendy in the UK especially to go abroad, #turkey teeth, to get 20 crowns placed as a quick fix to get a more aesthetic smile. But as we know, instant gratification is never the best way, and having so many crowns placed requires the dentist to remove a lot of your natural tooth structure, more than necessary. And if too much tooth structure is removed, it can lead to a lot of problems in the future, such as needing root canal treatment, extraction, implants, issues with your gums or gum disease if the crowns are not adapted properly to your gums. I've actually seen a lot of patients in my clinic in London where they've gone abroad, a lot of them to Turkey. I hate to say it, I'm sure there are amazing dentists in Turkey as well, but a lot of these patients have gone to clinics in Turkey, had a full smile makeover with 20 crowns, and they've come back. Some of their crowns have fallen off within a few months of having them placed, and they've ended up with issues with their gums. They're getting gum inflammation, infections, they need root canals. Honestly, it's heartbreaking to see that, because I know inevitably, and they know, that it's going to lead to them losing all of their teeth one day. So any drastic smile makeover work, I would not go with. If you are unhappy with your smile, the best way to approach it is to come into our clinic, come and see me for an Invisalign or an orthodontic consultation, which is where we would straighten your teeth first, and we would pair that with a bit of teeth whitening. So very minimal approach. And if after that you still feel like you want to make some tweaks, then you can go in with a little bit of composite bonding or porcelain veneers, which removes much less tooth structure than a crown would. Basically, less is more. Having the most minimally invasive treatment is always better than jumping into the most invasive, drastic treatment method. So if you are unhappy with your smile, the best place to start is straighten your teeth with orthodontics, then whitening, and then a little bit of composite bonding or porcelain veneers where necessary. And the wonderful thing about porcelain veneers is that they can be done with very minimal prep nowadays, where you really are removing almost no tooth structure in order to accommodate the veneer. It is a much better option than going abroad or going to Turkey, #turkey teeth, and getting a mouthful of crowns. 10. I would never use a manual toothbrush. Electric toothbrushes are clinically proven to remove plaque much more efficiently than a manual toothbrush. And the risk often associated with using a manual toothbrush is that if you are really scrubbing and over brushing your teeth, it can cause gum recession and it can cause buccal abrasion cavities. Essentially, it can cause us to wear our tooth and wear the enamel. This happens a lot less with electric toothbrushes because oftentimes the newer electric toothbrushes have a little pressure sensor on them. So if you're pressing too hard, it will flash red and you know to kind of ease off with your pressure. So yeah, I would not use a manual toothbrush anymore. Those days are gone. We're past that now, guys. Just in case anyone's wondering, I use one of the Oral-B IO toothbrushes. I think I have the IO9 right now, but any of the Oral-B IO range is fantastic because the brush head oscillates, which means it kind of moves from side to side, as well as vibrating with the sonic technology. So between those two movements, it just removes plaque so efficiently. And because the brush head is super small and circular, it actually gets into the hard to reach places in the mouth really well. So it gets into the area of the wisdom teeth really well, or the back of the mouth. So I really do love the Oral-B electric toothbrushes. This is not sponsored by Oral-B, by the way, but just thought I'd give them a shout out. So those are the 10 things I would never do myself to my own teeth as a cosmetic dentist. I hope you learned something from this and it brought you value. If there are any other topics you'd like me to discuss, please leave it in a comment below. I will link another video for you to watch up here, and I hope you have a wonderful day. Thank you so much for joining me, and talk to you next time. Bye.